Good evening, one and all. As the popular saying goes, he who has health has hope, and he who has hope has everything. And today, we celebrate those who continuously inspire hope through their remarkable innovations in healthcare. Ladies and gentlemen, welcome to the inaugural edition of Times Network India Health Awards 2024. Can we kickstart by bringing some energy and putting our hands together? I am Namrata Sehrawat and I'm absolutely elated to be your host. The Indian healthcare industry is growing at a tremendous pace, driven by strengthening coverages, enhanced services, and also impacting a lot of people, increasing the expenditures from both public as well as private sectors. In 2022, it reached a remarkable milestone of $370 billion. And the projection suggests that it will soar till $610 billion. At India Health Awards, Times Network aims to honor and recognize the pioneers and doers who have been leading this transformative change with their excellence and innovation. This prestigious platform aims to celebrate those who have always been at the forefront, and it aims to celebrate the outstanding contributions of the individuals, organizations, as well as initiatives that are revolutionizing the healthcare delivery. They are improving the patient outcomes and advancing medical research across the nation. But right before we delve into the official proceedings, we would sincerely like to extend a heartfelt gratitude to all our sponsors for their valuable contribution. This initiative is powered by DBS Bank, our luxury real estate partner M3M India, our luxury partner Silver Arrows, and our knowledge partner Dr. MGR Educational and Research Institute. Can we please put our hands together louder for all the sponsors? Thank you. So right before we begin, I would like to check that how many men and women do we have here in the room? So all the talented, beautiful, gorgeous women, can we please mark our presence by putting our hands together? Let me hear from all the ladies. All the ladies. Fantastic. Fantastic. I can see, I can feel that not just women, we have some super women here. And I cannot wait to see how this evening unfolds with all of you. Now, all the handsome, charming men I see sitting here in the blazers, can we give a roaring round of applause? Come on, bring it in, bring it in. Fantastic, fantastic. Well, I can tell that it's going to be a really interesting evening ahead, so cannot wait. All right, so on that note, ladies and gentlemen, to officially commence this evening and deliver the welcome address, I would like to call upon stage Mr. Rohit Chadda, President and COO Times Network. Please put your hands together as we welcome him here. Over to you, Rohit.
Good evening, ladies and gentlemen. Welcome to the Times Network Health Awards. It is our honor to host this distinguished gathering of India's leading doctors and medical professionals. Tonight, we come together not just to celebrate the pinnacle of excellence in healthcare, but also to mark an exciting new chapter in our journey at Times Network. Friends, in the last few years, COVID-19 pandemic has profoundly underscored the critical importance of a robust healthcare system. It has exposed gaps in the healthcare infrastructure and highlighted the urgent need for resilience and preparedness. Ensuring access to quality healthcare is not just about treating illnesses, but about constructing systems that can effectively tackle future health challenges. A strong healthcare system is foundational for early detection, efficient response, and economic stability. Healthy populations drive productivity and fuel economic growth. Thus, investing in healthcare is a strategic move that benefits individuals and broader economy alike. It is imperative for governments and private sector to prioritize investments in healthcare technology, improve accessibility, and adapt systems to meet both current and future needs. At Times Network, we recognize our role in this crucial endeavor. We are home to some of India's premier digital brands: Times Now, ET Now, Times Now Navbharat, Zoom TV, Digit, Times Drive, Sports Now, and many more. Each month, we engage with hundreds of millions of viewers through our diverse platforms across websites, apps, social media, and YouTube. But tonight holds a special significance for us. We are thrilled to announce our latest initiative, healthandme.com, a dedicated health news and information platform crafted with passion by our editorial, product, technology, and design teams. Health and Me is designed to be your daily health companion and the go-to destination for every Indian seeking reliable and up-to-date health information. We're also delighted to have with us Mr. Milind Soman, a renowned actor and fitness icon whose presence adds an inspiring touch to our evening. As we look ahead, technology promises to revolutionize healthcare in transformative ways. Innovations such as AI, robotics, and big data analytics are set to enhance patient care and outcomes. According to WHO, India will need 1.8 million physicians and nurses to achieve the standard of 44.5 health workers per 10,000 people by 2030. AI could play a crucial role in addressing this shortfall by leveraging precision medicine and genomic data to create tailored treatment plans. Wearable devices and health monitoring apps will empower individuals to manage their health proactively, offering real-time insights into vital signs and chronic conditions. Furthermore, enhanced advancements in genomics and biotechnology will enable more precise and effective treatments tailored to individual genetic profiles. The integration of these technologies will not only improve efficiency and accessibility, but also pave the way for a more responsive and preventive approach to healthcare management. Together, tonight, we are eager to engage in discussions on making healthcare sustainable with optimal use of technology and adoption of technology for improved accessibility and affordability. Thank you for joining us in this significant moment. Let us celebrate the achievements in healthcare and look forward to a future where health and technology continue to evolve together for the betterment of all. Enjoy the evening.
Thank you. Thank you so much, Mr. Chadda, for wonderfully setting the context for the evening and sharing your valuable insights with us. On that note, ladies and gentlemen, right before we begin, I think some ice needs to be broken here in the room. So let's do that. So since we have a lot of healthcare professionals here, we have all our experts sitting right in front of us, I think now is the time where I should be posing one very interesting question. I think if you go to the social media, be it Instagram, Facebook, or any other social media platform for that matter, you see everyone there is a healthcare professional now. In some or the other way, everybody is imparting knowledge, which is very good. So, I can tell a lot of interesting things that I read online. If I point particularly to the social media, especially the use of flax seeds, chia seeds for weight loss. There are videos which, they say that they can help you lose weight 6 kgs in 1 week. But since we have the professionals sitting right in front of us, I think now is the time where I should be asking this question. Do you think that that is possible? 6 kgs in 1 week? If not, would you like to bust this myth? And any particular advice, tips, tricks that you would like to share, which you feel is mandatory Everyone from an infant, from a child to somebody who is in their old age should follow to keep themselves healthy. Anybody who would like to go first? Right before we delve into the official proceedings, because something very interesting is coming right after this. And it is related to all the up-to-date information, all the accurate information, which is reliable, easy to comprehend. But I think we should begin with you first. So, what do you say? Who is up to share their knowledge, their thoughts, their perspective on this? Come on, quick raise of hands. Ma'am, I think you're smiling, and I can see something is coming from your side. One thing which everyone should do to keep themselves fit. Come on.
I look like a doctor, but I'm not a doctor.
Yes, absolutely. Ladies and gentlemen, can you please give a big hand as we welcome none other than Milind Soman here. Hey, thank you so much, Milind. I think I've been asking everyone one very interesting question, and I think you're the perfect person to, answer this. I've been asking them to share one interesting advice that everyone should follow to keep themselves healthy and fit. Anything coming from you would be great.
Just keep moving. Keep moving. Stay off the chair. Okay. Yeah.
Fantastic. Just keep moving and stay off the chair. And I think I'm on duty now onwards after this to make that happen here in the room, because I have the responsibility now to keep you moving. All right. On that note, ladies and gentlemen, we now move to a very exciting phase where we unveil the digital arm of Times Network, which will empower you with the accurate, up-to-date information, the practical advice, the expert insights, which will help you to keep yourselves healthy and fit. It aims to cover all the aspects of physical and mental health. As our writers are working very closely with all the healthcare professionals, all the fitness trainers, nutritionists, to provide you, to bring the content which is easily accessible to all, which is reliable and absolutely easy to understand. So to do the honors, I would request Mr. Chadda to please join us back on stage. And ladies and gentlemen, please put your hands together as we welcome the supermodel, the actor, the film producer, and absolute fitness enthusiast, none other than Milind Soman here. Hi, Milind. Welcome to you once again. It's so good to have you here. So, ladies and gentlemen, without any further ado, I think now is the right opportunity where we should delve into this exciting launch, this exciting unveiling. We present to you healthandme.com. So, may I request my team to kindly bring the remote as we do the unveiling, and you already have it, Rohit, there with you. So along with Milind, let's press the button together. Let's do it on the count of 3, 2, 1.
Health is the foundation of a happy and fulfilling life. Times Network's newest initiative is here to bridge the gap between you and your well-being. Presenting healthandme.com, your trusted health expert. Healthandme.com provides a comprehensive study of health conditions, A to Z, quite literally. The website has answers to all your common concerns and empowers you with the right information. Health and Me also brings you WhatsApp interaction at your disposal, benefiting from the valuable and verified insights of health experts. The website will gain immense strength from exclusive and verified collaborations with top industry leaders and doctors for one-on-one sessions on health, fitness, and therapy. We also take immense pride in making healthandme.com one of the first websites to highlight parenting. We will be a companion in your life-altering parenting journey, providing necessary information just a click away. We understand the importance of mental health. Healthandme.com will take a deep dive approach to provide credible material on dealing with stress and anxiety. Your mental well-being will be a priority here. So brace up to have a health companion by your side that cares and prioritizes you. With this Times Network initiative, let's hope to make a difference. Because remember, ultimate wealth lies in nothing else but good health. Presenting healthandme.com, your trusted health expert.
Ladies and gentlemen, here we have healthandme.com, which provides a comprehensive study of all the health conditions from A to Z, quite literally. Thank you so much, Rohit, and thank you, Milind, for doing the honors. May I request your presence for some more time here on stage as now we delve into the much anticipated part of the evening. You're requested to please join us right at the center of the stage. Ladies and gentlemen, now is the time where we are going to honor excellence and innovation and the transformative impact of all those individuals who are dedicated to the health and well-being of communities across India. So yes, we are delving into the first segment of Times Network India Health Awards 2024. So ladies and gentlemen, our first category of award, and right before I delve into that, I think it would be great as all our achievers, our winners would join us here on stage. We would expect some applauses from all of you. I think we're here to celebrate all of them, so that would be highly appreciated. So our first category of awards is All India Best Multi-Speciality Hospitals Group. And it goes to none other than Apollo Hospitals Group. May I humbly request Mr. Madhu Shashidhar, President and CEO, Apollo Hospitals Group, to please join us on stage and receive this prestigious award. Many, many congratulations to Apollo Hospitals Group. Mr. Shashidhar, you represent such a magnanimous and prestigious hospitals group. So how are you feeling right now upon receiving this prestigious award? Any words from you would be great.
No, thank you. I didn't expect to speak, but I think Rohit said this very well, right? What an amazing time to be in healthcare. Whether it is big data, AI, robotics, there's a lot that is happening. Decades of work in unlocking the genome. We are now translating that into therapies. But in the end, healthcare is about people taking care of other people. So I'm privileged to have some of the best clinicians. Some of them are in the room with me. So thank you on behalf of more than 80,000 caregivers who call Apollo their family. Thank you all.
Hey, thank you. Thank you for your thoughts and congratulations once again. With this, ladies and gentlemen, moving on to our next award category, which is All India Best Varicose Veins Hospital. And it goes to AVIS Hospitals. May I request Dr. Raja V. Kopala, Managing Director and Senior Varicose Veins Specialist, to please join us on stage to receive the award. Congratulations, AVIS Hospitals. Ladies and gentlemen, I believe we can keep the claps rolling. Congratulations. Moving on to our next award category, which is All India Best Multi-Speciality Cancer Care. And it goes to Apollo Cancer Centers. May I request Ms. Mansi Rajput, AVP Apollo Hospitals, to please join us on stage. Ladies and gentlemen, with a thunderous round of applause, congratulations to you, Apollo Cancer Centers. Our next award category is All India Best Single Speciality Cancer Hospital, and it goes to HCG Healthcare Global Enterprises Limited. May I request Dr. Sachin Trivedi, Director Medical Oncology, Dr. Trinanjan Basu, HOD Radiation Oncology, Nikhil Kulkarni, Senior Manager Corporate Marketing, to please join us on stage to receive this award. Gentlemen, can we please have you here? Many, many congratulations to HCG Healthcare Global Enterprises Limited. Congratulations. Congratulations once again. Moving on to the next category, which is All India Best Liver Transplantation Hospital. And it goes to Dr. Rela Institute and Medical Center. May I request Dr. Ilan Kumaran, CEO, Rela Hospitals, to please join us on stage and receive this award on behalf of Dr. Rela. So let me tell you something about Dr. Rela, that he has performed more than 6,000 liver transplants, and he has received a Guinness World Record for performing a liver transplant on a 5-year-old baby. So congratulations to Dr. Rela Institute and Medical Center. Ladies and gentlemen, our next award category is All India Best in Pediatric and Child Care, and it goes to Apollo Children's Hospitals Network. May I request Dr. Karan Thakur, the Vice President at Apollo Children's Hospitals Network, to please join us on stage and receive this award. Congratulations to you. Can we please put our hands together louder, ladies and gentlemen, for Apollo Children's Hospitals Network. Moving on to the next award category, which is All India Best Technologically Advanced Oncology Center. And this award goes to Omega Hospitals. May I request Chaudhry Hargovind, President, Omega Hospitals Group, to please join us on stage to collect the award. Congratulations to Omega Hospitals. Ladies and gentlemen, I believe we can do better with the applauses. Come on. Our next award category is All India Best Diabetes Care Chain. And this prestigious award goes to Dr. Mohan's Diabetes Specialty Center. May I request Mr. Saravanan Raman, Chief Marketing Officer, to please join us on stage to receive the award. Congratulations. Ladies and gentlemen, moving on to our next award category, which is Leadership in Community Cancer Care West. And it goes to Mumbai Onco Care Center. May I request Dr. Mangesh Mekha and Dr. Abhishek Kakru, Consultant Medical Oncologists, to please join us on stage to receive the award. Heartiest congratulations to you. Ladies and gentlemen, I think we can do better than that. We can give a louder round of applause for Mumbai Onco Care Center. Congratulations. Our next award category is All India Best in Pain Management. And this prestigious award goes to Indo-British Advanced Pain Clinic. May I request Dr. B. Vijay Bhaskar, the founder and director, to please join us on stage and receive this award. Congratulations to Indo-British Advanced Pain Clinic. Proceeding to the next award category, which is Excellence in Cardiology. And this award goes to Dr. Vanita Arora, Senior Consultant Cardiology at Apollo Hospitals, Delhi. Congratulations to you, Dr. Arora. Looking absolutely gorgeous in the vibrant pink today. Moving on to the next award category, ladies and gentlemen, which is Excellence in Dental Implants, Hyderabad. And it goes to Dr. Venkat Ratna Nag, Managing Director, the Dental Specialist. May I request Dr. Nag to please join us on stage. Many, many congratulations. We are celebrating the excellence here, ladies and gentlemen. I think we can do that with more thunderous round of applause. Thank you so much. Moving on to the next award category, which is Best Liver Transplant Center in Western India. And it goes to Saidari Hospitals. Congratulations to you. May I request Dr. Sunil Rao, Group COO, Dr. Manish Pathak, Transplant Anesthetist, to please join us on stage to collect this award. Many, many congratulations. And moving on to our next award for the first segment, which is All India Best Dental Clinic Chain. And this award goes to Dents Dental. May I request Dr. Akansha Chandak, the head doctor, to please join us on stage and receive this award. Congratulations to you. Ladies and gentlemen, please give a big hand for Dents Dental. Congratulations. Thank you so much, Milind. Thank you, Rohit, for doing the honors of presenting the awards. May I request you to please be seated now. Please have a seat. Ladies and gentlemen, now we are delving into a very interesting panel discussion. I would request my team to kindly set the stage. So as we all know that healthcare sector is at crossroads, and with the rapid advancement of technology, we have the opportunity to enhance the patient care while also making our systems more sustainable. So today in this panel, we will explore that how we can leverage technology to improve the healthcare efficiency, reduce the cost, and ultimately create a more sustainable future for all. So we have put together an illustrious panel who would be sharing their perspectives and thoughts during this conversation. So right before we delve into the panel and hear the insights of our brilliant panelists, our experts who would be joining us here today, I think I should pose the same question to you. How we can leverage the technology to enhance the better healthcare in the industry. So just yesterday, I was reading this news wherein with the use of this new technology called the stem cell treatment, there has been a cure found for the cancer. I mean, the studies, the tests are still going on, but it seems to be quite promising itself. And I'm sure you of all people, being the healthcare professionals, must be incorporating a lot of technology, right? So any particular technology that you have come across which has made your life easier, which has made the healthcare much more easier for you to, treat your patients better. So anything that you would like to share on that? Any new technology that you have come across and that you would like to share with the audiences as well? Yes, of course, sir. Hi. May I know your name, please?
Hi, my name is Dr. Sachin Trivedi. I'm a medical oncologist. I'm Director of Medical Oncology at HCG in Mumbai. So, yes, it's a very interesting question you've asked. And I must say that actually we are at a cusp of revolution. It's very possible that we are already in a revolution. We only are not able to see it. So things that when we were in medical school we thought was impossible, we are already practicing it now. So just to give you an example, I'll give you an example of a technology, a diagnostic technology and a treatment technology.
Okay. Wow.
So the diagnostic side of things, there's a thing called next generation sequencing, where we are able to now analyze the complete genomic makeup of cancer. Once you know the enemy, then you can actually deal with it in a much better way. then you can actually have a targeted and precise medicine to be delivered to the patient, which has minimal, if any, side effects, but has the best outcome. That's a technology that we are already using. The other one is immunotherapy. You must have heard about immunotherapy, right? Yeah, so immunotherapy is a technology where we use a drug to actually unmask the cancer and expose it to your body's immune system. So it's your immune system in the body that kills it. So there are many things to discuss, but I'm sure the panelists will actually bring it up.
Absolutely, fantastic. Thank you so much for sharing your thoughts with us. And as very rightly said, we are at the cusp of revolution. And definitely, I cannot wait to hear the insights of our panelists on this. So, to moderate this panel discussion, I would like to call upon our wonderful moderator who has been bestowed with the opportunity to extract all the perspectives and drive this conversation forward. Please join me in welcoming Manas Tiwari, Technology Editor at Times Network. Welcome to you, Manas. Ladies and gentlemen, with some applauses, let's welcome our esteemed panelists on stage. We have Dr. Randeep Guleria, Chairman, Institute of Internal Medicine, Respiratory and Sleep Medicine at Medanta Medical School. Welcome to you, sir. Dr. Guleria, can we please have you here on stage? We have Dr. Raja V. Kopala, Managing Director and Senior Varicose Vein Specialist at AVIS Hospitals. Welcome to you, Dr. Kopala. Please have a seat at the dais. Ladies and gentlemen, with some applauses, let's welcome Mr. Gaurav Parchani, co-founder and CTO at Dozy. Welcome to you, sir. We have Mr. Prashant Madhwana, co-founder and CEO at Fedo. Mr. Prashant, can we please have you here on stage? A warm welcome to all the panelists. You're requested to kindly be seated at the dais. And over to you, Manas.
Hello. Thank you so much. So a few minutes ago, Rohit just mentioned that this is an exciting time to be in healthcare. I say this is also a very exciting time to be in tech, especially given the kind of advancements we have made in artificial intelligence space in the recent times. And here we are here to discuss how we can make healthcare more sustainable with the optimal use of technology. Now, I say sustainable healthcare has a different definition for everyone, let's say. So I want to open this session with your quick thoughts and definition of sustainable healthcare in context to the times that we live in. Times that we live in.
So, if I may start. So, if we look at current, as has been already said, we are living through a revolution, the so-called fourth industrial revolution. And it's being driven by two things. One is technology, and the other is major advances in the area of pharmaceuticals, whether it be vaccine or whether it be drugs. But the main issue that I think we need to look at is sustainable, which means it should be cost-effective, patient-centric, and therefore should be able to deliver as far as the needy patients are concerned. So as we move forward, technology is coming in, but the cost of the technology also needs to be kept in mind so that it is affordable and is something that can be used by the common person. So I think the key issue here is technology will change the way medicine is being practiced in the next 10 years. I can't even guess how the future doctors would be 20 years from now, with so much of technology coming in, artificial intelligence, big data, your wearable devices and non-wearable devices, monitoring which is happening. So all of this will change. But I think we also need to focus more and more on preventive health as far as technology is concerned, rather than only on curative health.
Raja.
Yeah, so I think he makes a very valid point. So in a large country like ours, the sustainability is almost synonymous with affordability. It's very important to understand that. But if you see the role of technology, technology can actually come in whenever there is a frequent, repetitive activity that has to be done in the same protocol in the process. And that can technology can easily replace those activities. So we see applications that are crazy. Right now, we're talking about drug discovery on one side. The steps of drug discovery can be, 100th in the next 5 years, they're saying, the drug discovery on that end, to even preventative health. We can get so many things from preventative health. The government is very serious about a national health stack. They want to create just like you have a financial ID now, UPI, they want to have a health ID, which is almost come to fruition. And if that comes, and then we can plug those into the technology aspects, it'll be just mind-boggling, and that actually will reduce the cost as well. So I think we are in for very exciting times, very wonderful and very thrilling times for the next 10 years.
So I think very, very amazing points made by both my co-panelists as well, right? Particularly costs. When you talk about sustainable healthcare, costs are right up there as the top metric that it should be adhered to. But I think adding inclusiveness is as important as well. Hyper concentration of best healthcare services in urban areas for people who can afford. I think we need to target, yes, cost as well, but also accessibility of healthcare as well as a metric. But particularly in today's time, right? And coming from the technology background, I really feel sometimes technology goes way ahead, and because of our limitations, human limitations, the protocols and processes that we've kept, we don't challenge them enough, right? So we really need to challenge protocols. For example, the field that I come from, monitoring an early warning system, from the last 2 decades, we use the same early warning scores, right? Now we have machines that can capture data much more frequently, can capture much more dimensions of a patient. So the early warning systems need to be adaptive enough to include that new technology and the benefits that it's getting as well. So we really need to be open to reimagine these protocols, reimagine these processes, keeping in mind costs and accessibility. That's how essentially I feel in today's age, leveraging all resources that we have, not just humans, not just the human capital from an intelligence perspective, but also the technology capital that we have. That is how we can grow non-linearly, right? Otherwise, we'll keep growing linearly. And I think that's...
Yeah. All right. Prashant, you want to add something?
So what I believe is technology would pivot the healthcare from a reactive to a preventive healthcare. And that is where AI and constant data collection will help us lead to, and which obviously increases the accessibility of healthcare as well as figuring out the risk early on so that the costs come down. So technology is at a space where now 3G has moved into 4G to 5G. The mobiles are faster. The mobile phones are much faster than your laptop a few years back. So collection of data is there, fragmented, but companies like us would be able to pick this up and predict the future in the next few years. That is where we believe sustainability by reducing cost and increasing the resource allocation would help.
So a lot of interesting observations and points there, which I will try and touch upon during the course of this conversation. But I want to start with you, Dr. Raja, that see, when we talk about healthcare technology, we also have to identify the areas, the segments where we believe it is best deployed in. So have we been able to identify some of the key areas? How do you go about that?
Yeah, there is tremendous growth happening. For example, one of the things to easily automate and make a perfect case example would be diagnostics, for example. There are AI pathology companies that are left, right, center. One of the very huge companies coming out of India that has worldwide interest. I can name the company later if you want. And then there is, so this diagnostics, for example, can easily be, you can use technology to identify blood sample or a radiology report or a chest x-ray, or in fact, it can even help you even look at the chest x-ray better than there have been instances where it's been better than a human eye. We know this from mammography literature already. Mammography with digital help works better than probably human eye anymore. So we have that example, for example, that's easily we can do that. But I think at this point, India should look a little differently because we already have the UHID and a health ID and all. So we should deploy almost 80% of our technology tools into preventative health. And this is where we get maximum bang for buck because we keep talking about cost and sustainability. So I think that's the next step that's going to happen. I'm sure we'll have, I don't know if you know, but we have monitors that can tell 12 parameters that's on a fingertip. We have stroke preventative monitors that can, like a headband, and can predict a stroke 5 hours before. So these are all FDA approved and already available. We need to plug those into our chronic care patients, into our preventative care patients at their homes, not in the hospitals. It's too late by the time they come to the hospitals. So I think that's where the real bang for the buck lies, but some of it will happen very soon.
Now, almost all of you mentioned about the affordability part of things, right? How we need to also ensure that it is affordable to most people. Now, when I talk about India, there are almost two parts to our country. One is the rural area, and the other one is basically, rural is the Bharat that we usually talk about. And then there is urban areas. So, Dr. Ramandeep, I want to understand from you, like when we deploy some of these technologies, how do we ensure that we make them affordable for those rural areas, for those people who come from Bharat? And maybe Gaurav, you and Prashant can also weigh into it later on.
So I think the challenge here is what we would call frugal innovation. You would have to be innovative. In India, we use a term in India which is known as jugaad. So if we are able to do that, be frugal in our innovation, then I'm sure we can develop technology which is made in India and can be used in India at a much more cost-effective manner. A lot of this we were able to demonstrate during the pandemic. Whether we look at ventilators, whether we look at different devices, even masks for that matter, PPEs, vaccine, we were able to do that at a much lower cost. So I think the technology is there, it's just connecting the dots that is very, very important to be able to do it. But I think the technology and the frugal innovation exists as far as India is concerned. And we need to look at it, how is it practical in our setup? We cannot borrow something from the West and just put it here. We have different challenges, both related to the climate, both related to different terrain, and also in terms of different people in different areas. How can we use that to make it sort of practical in our country? That I think is also important.
You want to add something?
Yeah, absolutely. I think I 100% agree to Sir's point. Made in India is very important. Today we import close to 85% of medical devices that we use in the country. So there is no doubt in my mind that we will be a big consumer of technology, we will be a big consumer of health AI. But it's very important, and we stand at a juncture where not only we can make affordable, we can make amazing AI solutions. And I can expand that in just 30 seconds. What do you require for health AI? You require the best of healthcare professionals and the best of minds that are going to medical science. I think we have, most of them are in the room today.
Absolutely.
We require best of machine learning engineers. I think we have plenty of them as well. And the most importantly, we require diverse pool of data, right? Diverse pool of tag data. I don't think there's any more diversity around the world in any country than India. The length and breadth of our country when it comes to different population, different age groups, different demographics. I think we can leverage that to make top quality health AI products. And let me give you quick examples. Pulse oximetry failed Africa during COVID, right? There are many studies published on this, right? They don't work very good on darker skin. And many of these patients were not identified at the right time, led to deterioration, led to adverse events, led to bad outcomes even, right? Because the first world never made these medical devices or never made these products keeping the world in mind. But when India makes, it will make for entire Bharat, not just Delhi, not just Bangalore, not just Bombay, but the entire Bharat, right? And that is what we need to leverage. So yes, cost is important, but effectiveness and the quality of the product. This is the time for us to leapfrog, and we have a unique opportunity to use the diverse pool of data that we have to create the best AI solutions that the world has seen.
Prashant, you?
So we all talk about new technology and AI. So something which we do is we pick up vital parameters from using a mobile phone, like your heart rate, blood pressure, etc. Now the funny part is if I take it to any doctor, I'm usually thrown out of his office. But we get acceptance of new technologies very low in medical fraternity. Obviously, I understand there is a higher requirement of accuracies, but then we have to go in other ways, like we have to start with insurance and other places where the accuracies might not be that important, and this technology is adopted. Now, if you check the same blood pressure in a same digital monitor twice, you will have two different readings. But people are not ready to check a new technology coming up, maybe because you are used to a particular way of using technology as of now. So that is something which I want to mention in this group.
Sir mentioned about the impact on climate, and you mentioned about integrating AI within healthcare, and I want to talk about that in a minute, but I want to stay on this topic of affordability for now, because see, any technology, when you are the early adopter of that technology, there's a high cost that is usually attached to it. Let's take the example of AI. Now, a company like OpenAI, which is sort of the pioneer of making AI mainstream, Microsoft is burning cash like anything on that, right? So when we deploy a new technology in healthcare, let's say, and I want to understand from both of you, that how do you balance the initial cost that is attached to it and the long-term benefits that come with it and the sustainability that comes with it? How do you prioritize the both, and how do you find a balance between the two?
So I think that is the biggest challenge, because as the technology comes in the beginning, the cost is going to be higher. As your, let's say, sales become more, as the number of users become more, the cost will come down dramatically. That's true for even, let's say, new molecules or new drugs which come into the market. But this is where I think that there has to be some support from various sectors, including the government sector, that they support this technology in the beginning when the investment is much more. And they get the returns later on as the number of, let's say, users become much more and the cost therefore comes down significantly. But I think that is a challenge that we need to address and see how we can go about it.
Dr. Radha, you have anything to add to that?
Yeah, so they say power of technology is overestimated in the short term and underestimated in the long term. So it's very important to draw a balance, while chasing technology. Even a 1% inaccurate technology or a 0.5% inaccurate technology can play havoc with this processes. So adoption has to be there and adoption has to be rapid, but adoption also has to be guarded against that. And I do believe a lot of this push has to, as the sir rightly said, has to come from the government control bodies. For example, we said clopidogrel is not 450 rupees, it's 80 rupees one day. And we thought that clopidogrel will stop manufacturing. Well, they didn't. And they made the drug and it still is available. So the price of the drug was reduced to 1/5, right? And still people sucked it up and took it up. So I think that's where it comes. When there's going to be a mass adaptation of a technology, I think government has to step in with its set of rules, all the way from privacy to, I think we need to be a little step ahead of that. And one beautiful example is that we had nearly a 30-year-old law against telemedicine, which wasn't helping us give online consults. One day, the government changed it during COVID, and thanks to Sir and big, people like him. And it's amazing that happened. Now we can give a prescription WhatsApp suddenly. So when government wants, it moves brilliantly fast, and it can change the whole landscape in 10 minutes. So I hope that happens.
Yeah, absolutely. Now, we don't have much time, so Gaurav, Prashant, quickly want to touch upon the AI aspect of things right now. How do you integrate AI within healthcare services while keeping in the very important aspect of privacy? Because there is that attached to it as well.
So I think the privacy part is easier because there are already standards around this. Personally identifiable information have to be separate, should not be used in any sort of modeling, should not be shared across at all, and even the health information should also be shared with consent, right? So I think those parts are pretty easier. There are certain laws around this already, guidelines. In fact, the DPDP Act also touches upon aspects of patient privacy particularly, and then in how to use it around digital solutions and AI solutions altogether. I think a bigger barrier for adopting technology beyond this is essentially, I would say, we don't understand AI really well, right? We, as healthcare professionals, they are the masters of physiology, but when it comes to AI, it's just a very surface level understanding. And for us technology folks, our physiology understanding is not just even the surface, right? So there needs to be a much more tighter handshake when it comes to exchanging notes, co-developing solutions together, so that we actually make relevant solutions and not just like in our bubble that, okay, these would be relevant and the healthcare professionals rejecting it at face value, that this is not really important, right? So I think a bigger barrier is a tighter handshake. The rest of the stuff is pretty figured out. Like there are regulations around this. I don't think that should be a concern altogether.
Prashant.
So as Gaurav was saying, privacy is something which we could take care of. But obviously to build any AI system, we need data. So how do we collect data without actually impacting anybody's privacy or intruding into their personal data is something which we will have to work together. But for a country like India, where we are very strong in technology and we have a lot of data, like any doctor here would have seen more patients than a country in Europe. So we have both technology as well as data here and expertise in the medical field. I think the next decade would be us for AI in healthcare.
Any particular area where you have seen that AI has yielded better results or is more useful?
So, for me, if I had to pinpoint, there are tremendous use cases of AI.
I'm sure.
But if I had to pinpoint the value that we will get in the short term and in the next decade, mass level screenings, risk stratifications, and then planning, policy planning accordingly. I think that is a piece that will be solved with AI very soon.
Sir, do you agree with that, or there are other possibilities?
Yes, I agree with that. I think if you look at AI, it will change the scenario when it comes to mass level screening, whether it be radiology. Currently, we have AI being used in rural India in many states. Doing a chest X-ray is done, AI interprets it, whether it is tuberculosis or not, and that is very accurate. You have AI which could actually be used in a lot of radiology and also in dermatology, where you could actually take a picture of your skin lesion and AI could help you diagnose what it is. And in a similar way in pathology, where it could also help you when sometimes you may miss an abnormal cell when you're looking at it under the microscope. So AI will come in a big way, both in the diagnostic area, but also in terms of, let's say, the planning or in terms of delivery as far as healthcare is concerned. But I think, as has been rightly said, the healthcare sector, and especially doctors, have been slow to adopt technology. And I think we need to move out of our silos. There is a need for doctors, engineers, computer scientists, people in humanities to start interacting with each other and seeing how we can provide best and affordable care to our patients.
It's also because you need a complete reorientation of workers, because they are the ones who are eventually using this technology, something that we'll probably touch upon in our next session, which will have in some time. So I think, thank you so much, gentlemen. That was our time. I hope, some really interesting insights, some really interesting thoughts over there. I know that we as a country have the technology, we have the will, and we have the talent. So together, healthcare and technology will do some exciting things in future. Thank you so much.
Gentlemen, may we request you to please stay back on stage for a group photograph? Can we please come together? Thank you so much for sharing your brilliant perspectives and insights with all of us. And I would humbly request Mr. Rohit Chadha to please join us on stage to kindly felicitate all the panelists. Let's all come together for a group photograph first. Thank you. Ladies and gentlemen, please put your hands together for all our esteemed panelists for sharing their brilliant perspective with all of us. Mr. Chadha, may I request you to kindly honor and felicitate Dr. Guleria on stage. All the panelists are requested to please stay back on stage for one more moment. We have Dr. Randeep Guleria, Chairman, Institute of Internal Medicine, Respiratory and Sleep Medicine at Medanta Medical School. We have Dr. Raja V. Kopala, Managing Director and Senior Varicose Vein Specialist at AVIS Hospitals. Mr. Gaurav Parchani, Co-Founder and CTO at Dozy. And Mr. Prashant Madhwana, Co-Founder and CEO at FEDO. Thank you. Thank you so much, Mr. Chadha. Thank you, Manas, for wonderfully moderating the session. May I request the team to kindly set the stage? Thank you. Ladies and gentlemen, we are honored to introduce a key representative of our esteemed luxury real estate partner, M3M India. So please join me in welcoming on stage Mr. Rajesh Kaul, VP of Commercial Business for M3M India, with a huge round of applause. Hi, welcome to you, Mr. Kaul. First of all, thank you so much for being our luxury real estate partner. Over to you. Cannot wait to hear your insights.
Thank you so much, Namrata. You have been a wonderful host. Good evening, ladies and gentlemen. I am delighted to have the opportunity to present M3M India, one of the leading real estate developers in the country. First of all, I would like to express my deepest gratitude to all the people sitting out here, especially our health experts, our doctors. You all have been wonderful. You all have been our lifeline. So a big round of applause for all of you. Ladies and gentlemen, our growth is founded on the principles of ethical corporate governance, transparency, commitment, and passion. M3M laid a very strong foundation in year 2010. And over the period of these years, we have emerged as one of the leading developers within the country. I take deepest pride in announcing and sharing with you that M3M, over the period of these years, launched 56 projects. And we have delivered 2 crore square feet of area. M3M has 3,000 plus acres of land parcel, which is for the development now. And we are going to have the phenomenal opportunities for everyone to own a piece of M3M. Now, M3M has shown significant presence within the National Capital Region. Our projects are mainly located in the Gurgaon area. We have projects located in Noida, Panipat, and Delhi. Now, we have done some iconic developments within the National Capital Region. We have, I'm very proud and I'm glad to say that projects like Golf Estates, a project like Trump Towers in Gurgaon, and IFC have been our landmark projects which have actually given a name to the entire city. Ladies and gentlemen, today I am excited to give you glimpses of our latest luxury projects in Noida. We have laid a very strong foundation within Noida. So ladies and gentlemen, we have M3M The Cullinan and The Line, which are our recent developments within the Noida. So may I request my partners to share the AV. ladies and gentlemen, our projects have garnered immense customer base. We have got customers from abroad, we have got customers from India, and our customers are not only happy, but they are delighted. And they are delighted to be part of M3M family. So I thank you so much for your patience. I thank you for giving us this opportunity. And I assure you that our company is based on very strong values for our growth. We believe in having ethical corporate governance, transparency, commitment towards our customers, and passion. So thank you so much once again. And our team is there to assist. We have a counter outside. And once you're free, you are most welcome to visit us. We will be happy to assist you. Thank you so much. Thanks a lot.
Thank you. Thank you so much, Mr. Kaul, for sharing your thoughts and telling us about M3M India. On that note, ladies and gentlemen, we now take this opportunity to delve into the next segment of Times Network India Health Awards 2024. And now to do the honors, once again, I would like to call upon stage Mr. Rohit Chadda and Mr. Milind Soman. Can we please have you here? Milind, I think you're doing one thing which you absolutely love, moving. I understand. Gentlemen, you're requested to kindly be right at the center of the stage. Thank you. Ladies and gentlemen, our first category in this segment is Excellence in Fertility Care. And this award goes to none other than Dr. Rohan Palshetkar, Head of Unit at D.Y. Patil Fertility Center, Bloom IVF. May I request Dr. Palshetkar to please join us here and receive this award. Ladies and gentlemen, let's keep the claps rolling for Dr. Palshetkar. Congratulations to you. Moving on to our next award category, which is Excellence in Cardiology. And this prestigious award goes to Dr. Sai Satish, Senior Interventional Cardiologist at Apollo Hospitals, Chennai. May I request Dr. Satish to please join us on stage to receive this award. Thank you so much, ma'am, for collecting this on behalf of Dr. Sai Satish. Ladies and gentlemen, moving on to our next award category, which is Excellence in Gastroenterology. And this award goes to Dr. Mahesh Goenka from Apollo Hospitals, Kolkata. Since he's not present here, I would humbly request Dr. Karan Thakur to please join us on stage and receive this award on his behalf. Dr. Mahesh Goenka is the Director and Head of Department Gastroenterology at Apollo Hospitals, Kolkata. Many, many congratulations to him. Although he's currently not present here, but I believe we can still keep the claps rolling. Come on. Our next award category is Rising Voice in Dermatology. And this award goes to Dr. Alakya Singapore, Founder and Chief Dermatologist at The Skin Sense. May I request Dr. Alakya to please join us here on stage. Many, many congratulations to you. Congratulations to you, Dr. Alakya. Ladies and gentlemen, our next award category is Excellence in Neurosurgery. And this award goes to Dr. Gaurav Tyagi, Senior Consultant at Apollo Hospitals, Delhi. May I request Dr. Tyagi to please join us on stage and receive this award. Many, many congratulations to you. Ladies and gentlemen, let's give a thunderous round of applause for Dr. Tyagi upon receiving this prestigious award. Our next award category is Excellence in Interventional Cardiology, Hyderabad. And it goes to Dr. J. Shiv Kumar, Head of Cardiology Department. May I request Dr. J. Shiv Kumar to please join us on stage and receive this award. Many, many congratulations to you, sir. Our next award category, ladies and gentlemen, as we delve into that, is for Excellence in Otology and Middle Ear Implants, Hyderabad. And it goes to Dr. Jaswinder Singh Saluja, Senior Consultant at ENT Department. Congratulations to you, Dr. Saluja. Ladies and gentlemen, let's give a roaring round of applause for Dr. Jaswinder Singh Saluja. Moving on to the next award category, which is Bharat Health Tech AI Innovation. And this award goes to none other than Dozy. May I humbly request Mr. Gaurav Parchani, co-founder and CTO Dozy, to please join us on stage and receive this award. Congratulations. Ladies and gentlemen, our next award is for All India Excellence in Robotic Surgery in Gynecology. And it goes to Dr. Ruma Sinha, Chief Gynecologist and Clinical Lead Gynecology Robotic Surgery. Ma'am, may I request you to please join us on stage and receive this award. Congratulations. Ladies and gentlemen, moving on to our next award category, which is for the most valuable health tech company. And it goes to humanfractal.ai. May I request Mr. Raj Shekhar Pulla Bhatla to please join us on stage and collect this award. Congratulations to you. Humanfractal.ai. Congratulations once again. Moving on to the next award category, which is All India Best in Organ Transplants. And it goes to MGM Healthcare, Chennai. Congratulations. May I request a representative to please join us on stage and receive this award. I would request Senthil to please join us here and receive this award on behalf of MGM Healthcare, Chennai. Our next award category is Excellence in Internal Medicine and Music Therapy, Hyderabad. And it goes to Dr. Jaganmani Shrikant, Senior Consultant and Head of the Academics. May I request Dr. Shrikant to please join us on stage and receive this award. Many, many congratulations to you. Ladies and gentlemen, especially the ones who are sitting at the back, I believe we can put our hands together louder once again. Ladies and gentlemen, our next award is for the Excellence in Neonatology North Region, and it goes to Dr. Avneet Kaur, Senior Neonatologist and Director at Department of Neonatology at Apollo Cradle, New Delhi. Congratulations to you, Dr. Kaur. Moving on to our next award category, which is Excellence in ENT, Hyderabad. And it goes to Dr. E.C. Vinaya Kumar, who is the head of ENT department at Apollo Health City. May I request Dr. Jaswinder Singh Saluja to please join us on stage and receive this award on behalf of Dr. Kumar. Congratulations. Our next award category is Excellence in Hip Replacement Surgeries, Hyderabad. And it goes to Dr. Balavardhan Reddy R., Senior Consultant, Orthopedics. May I request Dr. Reddy to please join us on stage and receive this award. Congratulations to you, Doctor. Ladies and gentlemen, with some applauses, let's move on to the next award category, which is for Excellence in First Aid and Preventive Pediatrics. And it goes to Dr. Shiva Ranjani Santosh, Pediatrics and Social Activist at Magna Centers. May I request Dr. Santosh to please join us on stage to receive the award. Congratulations to you, ma'am. Ladies and gentlemen, the next award category is Best Single Specialty Cancer Hospital West. And it goes to ACI Kumbala Hill Hospital. May I humbly request Dr. Rahul Bajpai, Group CEO and Director, to please join us on stage and receive this award. Congratulations to you. Okay, I think we can do much, much better than that. Yes, thank you. Thank you so much. Ladies and gentlemen, the next award is for the Excellence in Breast Surgery, and it goes to Dr. Geeta Kadyaprath, Senior Consultant at Apollo Cancer Center, Delhi. May I request someone to please join us on stage to collect this award on her behalf? Thank you, ma'am. I think we can keep the claps rolling for Dr. Geeta. Ladies and gentlemen, moving on to the next award category, which is for the Excellence in Neurology. And it goes to Dr. C. Rajesh Reddy from Apollo Health City, Hyderabad. Congratulations to you, Dr. Reddy. Many, many congratulations. Since they're celebrating their excellence and innovation, I think we can do it with some more energy, ladies and gentlemen. Our next award category is Excellence in Neurosurgery, and it goes to Dr. Alok Ranjan from Apollo Health City, Hyderabad. May I request Dr. Ranjan to please join us on stage and receive this award. Congratulations to you, Dr. Ranjan. Many, many congratulations. Our next award category is All India Best Emerging Neurology Hospital. And it goes to MGM Healthcare, Chennai. May I request Senthil to please join us on stage and receive this award on their behalf? Congratulations to MGM Healthcare. Although their representatives are not here, but we can still keep the claps rolling for them. Come on, let's do that. Thank you. Our next award category is Excellence in Internal Medicine, Respiratory and Sleep Medicine. And This prestigious award goes to none other than Dr. Randeep Guleria, Chairman, Institute of Internal Medicine, Respiratory and Sleep Medicine. Many, many congratulations to you, sir. Moving on to the next award category, which is Excellence in Cardiothoracic and Vascular Surgery. And it goes to Dr. Niranjan Hiramat, Senior Consultant at Apollo Hospitals, Delhi. May I request Dr. Niranjan to please join us on stage and receive this award. Congratulations. Ladies and gentlemen, some applauses, please, for Dr. Niranjan. Our next award category is Excellence in Neurosurgery, and it goes to Dr. Srinivasan Paramashivam, Senior Consultant at Apollo Hospitals, Chennai. Many, many congratulations to you. Ladies and gentlemen, can we please have some applauses for Dr. Srinivasan? Thank you. Our next award category is Excellence in Orthopedic Manual Therapy Practitioner and Osteopath, Chennai. And it goes to Dr. Balakumaran, Managing Director, Krishna Health Center. Dr. Balakumaran, may I request you to kindly join us here and receive this award. Ladies and gentlemen, let's keep the claps rolling. Heartiest congratulations to you, sir. Thank you. Thank you so much, Rohit. Thank you, Milind. May I request you to please be seated. Thank you once again for doing the honors of presenting the awards. Okay, ladies and gentlemen, may I request the team to please set the stage for the next part? Thank you. Ladies and gentlemen, so we have all the healthcare professionals, all the experts sitting right in front of me, but, I read it somewhere that when you put your hands together, when you bring your hands together, your body produces the feel-good hormones. So we actually want you to feel good. So right we delve into the awards ceremony, I would request all of you, because I thought I found a little bit lack of applauses here in the room, so let's maintain that for the next segment. All right before we delve into the next segment, I would once again like to thank all our sponsors for all their valuable contribution. This initiative is powered by DBS Bank. Thank you so much, DBS Bank. Our luxury real estate partner, M3M India. Our luxury partner, Silver Arrows. And our knowledge partner, Dr. MGR Educational and Research Institute. Once again, a big thanks to all our partners, all the sponsors, for their valuable contribution. On that note, ladies and gentlemen, now we are going to delve into the highly anticipated session that we are about to have. So I did not have the chance to introduce him properly before, but now I do. So since we already know him, he doesn't need any introduction at all, but still, let me tell you that he's a very renowned Indian supermodel. He's an actor, he's a film producer, and he's a fitness enthusiast who has inspired millions of people globally. From contributing to countries' tourism, promoting fitness and health, or becoming the face of social campaigns like women empowerment, he is a unique symphony of substance and style. Well, he is popular for his dedication to long-distance running, and he has completed numerous marathons, including the challenging Ironman triathlon, which he completed in 2015 at the age of 50. This achievement has inspired many and earned him accolades for his commitment to fitness. And today, we are going to have him here at this platform to share his journey, to inspire all of us with how he keeps himself so fit and healthy all the time, please join me in welcoming on stage none other than Milind Soman. And I would also request RJ Mohit from Radio Mirchi to please join us on stage as well. Welcome to you, Milind. It's so good to have you here, and we cannot wait to hear your insights. You're requested to please have a seat. Yes. Over to you, Mohit.
So, hi everyone. 98.3 मिर्ची से मैं हूँ दिल्ली का सबसे बड़ा फुकरा मिर्ची आरजे मोहित. क्या ही खूबसूरत लग रहे हो यार आप लोग. एक बार अपने लिए जोरदार तालियां होनी चाहिए यार. और आज सुबह से मैं घबराया हुआ था. मतलब मैं मम्मी को बोल रहा था कल रात से, मम्मी क्या पहन के जाऊं, कितना अच्छा लगना चाहिए, वहां सारे डॉक्टर्स होंगे. सो मम्मी ने मुझे एक ही बात बोली, मोहित कुछ भी पहन ले तू, तेरे साइड में आज मिलिंद सोमन होंगे, तुझे कोई वैसे भी नहीं देखने वाला. एक बार आयरन मैन के लिए जोरदार तालियां होनी चाहिए दोस्तों यार. मम्मी बहुत बड़ी फैन है सर आपकी, सो मैंने इनडायरेक्टली ऐसे भी आपको बता दिया.
What nice things you said about me. Thank you.
Yeah.
You've got a great voice.
Thank you so much sir. And क्योंकि मैं मम्मी की बात कर रहा हूँ, एक चीज मुझे और याद आई. मेरी मम्मी के लिए मैं भी मिलिंद सोमन हूँ. आपको पता है सर कितना कमाल भागते हैं, एथलीट हैं, रनर हैं. सो मेरी मम्मी के अकॉर्डिंग मैं भी जिम्मेदारियों से भागता हूँ. ठीक है.
But my mother always told me कि लोग क्या देखते हैं तुम में. सब बोलते हैं कितना गुड लुकिंग, मुझे तो नजर नहीं आ रहा.
बहुत सुंदर हो सर आप.
It's true.
उसके बाद बॉस कोई मुझे काम देता है, मैं वहां से भाग जाता हूं. जब डॉक्टर्स बचपन में मुझे इंजेक्शन लगा देते, मैं वहां से भी भाग जाता था. एक चीज है जो मुझसे दूर खुद भागती है, वो है पैसा. यहां पे मुझे थोड़ा सा बुरा लगता है. ऑलराइट, एक बार जोरदार तालियां अपने लिए. बहुत ही खूबसूरत ऑडियंस है सर. आई जस्ट वांटेड टू हैव सम कॉन्वर्सेशन विथ यू. बहुत जरूरी है. और मेरा सबसे
जरूरी क्यों है?
क्योंकि बॉस ने बोला है आज कुछ ऐसा करके आना, तेरी सैलरी बढ़ा देंगे. मेरे लिए बहुत जरूरी है.
Alright, I just wanted to say that I was pleasantly surprised. कि I on stage I met a lot of doctors that I knew personally, who I had met, and it's amazing. I met them all, and not when I was sick. Yeah, that is important to know. But I met so many of you, and I'd just like to thank all of you for all the wonderful, amazing work that you do all the time. And you're always there for people in need. Big round of applause to all of you.
All right. इसी नोट के साथ let's start this conversation. So मेरा सबसे
And I've always had great relationships with doctors. So all four of my grandparents were doctors. Just to let you know. My paternal father was the director of Hafkin Institute. My paternal grandmother used to teach at Lady Hardinge Medical College. And my other two grandparents on my maternal side used to practice medicine.
क्या बात है सर. एक बार जोरदार तालियां होनी चाहिए दोस्तों यार. So let's start this conversation.
Sure,
मेरा सबसे पहला सवाल आपसे. If you could go back in time,
yes,
or give yourself an advice to that 20-year-old Milind Soman, वो fitness advice क्या होगी and क्यों होगी सर?
I have no idea because 20-year-old Milind Soman was much fitter than me, and he was having a lot of fun. क्या नहीं था उसके पास? सिर्फ पैसे नहीं थे जो अभी है.
Yeah.
So, but yeah, I don't think I have any advice for him. In fact, even if he made some mistakes or whatever it is, I think those were great.
Right.
He learnt a lot.
Right.
And because of the mistakes he made and the lessons he learnt, I'm here today.
And वो जो 20 ईयर वाला मिलिंद सोमन था, I just wanted to know.
बहुत खूबसूरत था वो
खूबसूरत अभी भी बहुत ज्यादा है. तो क्या वो ऐसे गोलगप्पे और गुलाब जामुन ऐसे भर भर के खाया करते थे?
भर भर पे खाया करता था.
गोलगप्पे
भर भर के लोग मतलब ऐसे देखते थे कितना खा रहा है. या अभी भी बोलते हैं कितना खा रहा है, कहाँ जाता है ये सब, बोलते हैं अभी भी.
ग्रेट. और गोलगप्पे का नाम लेते ही सर मैम के मुंह में पानी आ गया एकदम. भाई आज तो खाऊंगी घर जाके.
आई थॉट यू वर गोलगप्पे का नाम लेते हुए वो देखो गोलगप्पा. आई होप आई जस्ट थॉट लाइक ओके.
सर अगर मैं बात करूं रेगुलर हेल्थ चेकअप्स की,
जी,
हाउ इंपॉर्टेंट डू यू फील दिस इज? बिकॉज कई बार हमें लगता है कि हम एक्टिव हैं और अंदर से हमें कई बार फील होता है कि हम बहुत ज्यादा हेल्दी हैं. सो हाउ डू यू फील अबाउट इट कि रेगुलर हेल्थ चेकअप्स हमें करवाने चाहिए?
सो आई हैव अ रेगुलर हेल्थ चेकअप वंस अ ईयर. एक शिकायत भी है मेरे पास, बट व्हाट आई फील इज मोर इम्पोर्टेंट इज व्हाट यू डू बिटवीन टू हेल्थ चेकअप्स.
Okay, yeah.
It's not just having the health checkup every time and discovering that your body is deteriorating or your mind is deteriorating. What you do between the health checkups, that is very, very important. जो लोग सिखाते हैं अक्सर, they just say come back for your next checkup after 1 year. And with me, the problem is that whenever I do a checkup, like for example, to do a stress test, the stress test is not a test for me.
Okay.
You know?
Yeah.
So I don't know what the doctor learns from that. I said, but you know, your stress test is so easy that I might have a heart attack tomorrow and you won't even know.
Right.
It's true. I've had these conversations.
Yeah.
Because I said the stress test that they formulate is for people who are not fit at all. There's no stress test for fit people.
Right.
Is that true? Yes. Sorry, are you a cardiologist? Okay. But anyway, I would like to know if we can work on something that is a stress test for fitter people, because most of the tests today are for really sedentary people who already have probably health issues. And I know a lot of people, and we've seen cases recently where people collapse in the gym, fit people running marathons at the end of the marathon or after the marathon. They're able to run 40 kilometers or 50 kilometers, but suddenly they have a heart attack and they die because they've not found whatever it is that is their weakness.
Right.
You know,
right,
I don't know what it is because I'm not a doctor.
Exactly. चलो फिर मैं क्योंकि मैम गोलगप्पों की बात कर रहा था, आपको ये बहुत अच्छा लगा सुन के, तो कुछ चटपटे क्वेश्चंस हो जाए एंड वी कॉल इट की रैपिड फायर क्वेश्चंस. सो रिलेटेड टू फिटनेस ही है. मैं आपसे
only 4 minutes 50 seconds.
ओके, ऑलराइट, बहुत फास्ट करेंगे. सो आप अपनी गो टू वर्कआउट एक्सरसाइज बताएं. मैं आपको एक सिचुएशन देता हूं. घर पर अगर आप हो और बाहर बारिश हो रही हो, तब आप क्या करते हैं? मैं समोसे खाता हूं चाय के साथ.
मैं तो घर पे ही एक्सरसाइज करता हूं. I've never been to a gym. I don't like gyms.
Okay.
मैं लाइफ में जिम में नहीं गया.
Okay.
So घर पे ही एक्सरसाइज करता हूं. My exercise is about say 10 minutes every day.
Okay.
It's mostly at home. Maybe 1 or 2 minutes is outside.
ऑलराइट.
Yeah.
और अगर आप स्ट्रेस में हो या बहुत ज्यादा ऐसे ग्रेटिट्यूड,
कभी स्ट्रेस नहीं होता.
कभी नहीं होता.
कभी नहीं.
उस टाइम
स्ट्रेस तो सबको होता है.
राइट.
बट आई एम वेरी कंफर्टेबल विद डीलिंग विद इट.
तो एक ऐसी एक्सरसाइज अगर मैं बहुत ज्यादा स्ट्रेस में हूँ, कौन सी सर आप मुझे सजेस्ट करना चाहिए?
आई वुड से ब्रीथिंग एक्सरसाइज.
ओके.
टू काम डाउन.
हाँ.
And just go to sleep. When you wake up, it'll be better.
All right.
I think so.
Yeah, perfect. अगर मैं हमारी ऑडियंस की बात करूं, हम सबके लिए एक सिंपल फन एक्सरसाइज अभी आप मुझे भी करवाएं, और आई जस्ट वांट कि आप मुझे बताएं सो दैट मैं भी घर जाके इस्तेमाल करूं उसे, मैं भी करूं एंड हमारी ऑडियंस भी करे. सर एक सिंपल कोई एक्सरसाइज.
You're going to do it.
मैं वैसे हार जाऊंगा.
With this jacket and all?
Sorry?
With the jacket?
Yeah, sir, I'll do it.
Okay, so get up.
Okay, I'll do it. I'll try, guys. एक बार मुझे चीयर करो. मैं सर से हारना नहीं
चाहता. चीयर करो. But you look like you can do it. It's called a burpee. You know what a burpee is?
Burping, yeah.
Have to do it. Show them. I'm sure they also know what it is. Does everybody know what a burpee is? Everyone. Who doesn't know what a burpee is?
I know it, but still I want कि Milind Soman मुझे बताएं.
Okay, come on. Give me a mic. What? You don't know what it is? Me do a burpee. I hate burpees. Do it. Yeah. Jump. Now put your hands on the ground. Kick your legs back. Yeah, do a push-up. Now bring your legs in front. Jump your legs in front. And jump. That's one burpee. Excellent. You want to do 10?
नहीं.
We don't have time. With only 2 minutes 46 seconds left.
आज मैं समझा मम्मी
Excellent.
मुझे नालायक फुकरा क्यों कहती है. यही रीजन है सर. बट इट वॉज अमेजिंग सर. और मैं भी
It's over. We have 2 minutes.
नहीं, मैं वही बता रहा हूँ. एक एक्सरसाइज मैं भी आप लोगों को बताना चाहता हूँ सर. हाउ मेनी पीपल आर मैरिड है? कौन कौन यहाँ पे शादीशुदा है?
मैं
थोड़ा सा चीयर करेंगे. थोड़ा सा चीयर करेंगे.
मैं
ओके. ऐसे नहीं आओगे. थोड़ा सा हु और हल्ला मचाएंगे. मैं अब डायरेक्टली सवाल पे आता हूँ. कौन कौन है जो बीवी से प्यार करता है? हल्ला मचाएंगे थोड़ा. सर मैं पड़ोस की बीवी की बात कर रहा था. क्या कर रहे हैं आप? ऑलराइट. सो सर आप ही के लिए मैं एक एक्सरसाइज बताऊंगा. कुछ नहीं करना है. बहुत ही सर ये एक्सरसाइज से मेरे पापा ने भी सीखी है एंड बहुत फायदा होता है आपको. सर प्लीज आप थोड़ा सा खड़े होंगे एक बार मेरे सामने. वेरी गुड. क्या लग रहे हो? माशाल्लाह सर. मेरे मुंह से आई लव यू निकल रहा है आपको देख के. यार तो हाथ लेने से ऐसे दोनों हाथ. ठीक है. हल्का सा पोज बनाना है. हाथों को बीच में आना है. एक बार सुबह एक बार शाम. सॉरी. बस ऐसे आपको वाइफ के आगे करना है. बहुत ही खूबसूरत सर. ये इफ आई एम नॉट
I approve.
इज इट?
I approve. It works. It works.
ऑल राइट सर. एंड जाते जाते मेरा एक सवाल है आपसे.
क्या?
बिकॉज डॉक्टर्स हमारे साथ हैं
जी.
मोहित आपके साथ है.
मोहित
सर एक फिटनेस एडवाइस हम सबके लिए, बिकॉज इट इज वेरी मच इंपॉर्टेंट आजकल के जमाने में. जैसा मैं कहता हूं, मेरे बॉस मुझे कई बार डांटते हैं, या मुझे काम का स्ट्रेस हो जाता है, मम्मी पापा मुझे इतना डांटते हैं. एक बहुत सिंपल स्ट्रेस को हटाने के लिए क्या एक्सरसाइज हो सकती है, या क्या वो फंडा हो सकता है जो आप भी अपनी डेली लाइफ में यूज करते हैं?
So ऐसा मैंने सुना है कि when you do something good for you yourself,
ओके,
because we all know what is bad for us, what is good for us, क्या हमारे लिए अच्छा है और क्या बुरा है, सब जानते हैं, ऐसी बोलने की जरूरत नहीं है. But if we do something that's good for ourselves, we lose a lot of stress. Stress is released. That is why exercise releases stress. So I can give them one example कि क्या कर सकते हैं, क्योंकि the biggest problem people face nowadays is most people are sitting all the time, working and sitting.
Right.
Nobody is working, running around. Right?
Exactly, yeah, right.
So what you have to do is every hour, put an alarm every hour,
Okay.
and every hour for 1 minute, do any activity that you like.
Okay. It works.
Oh, it works amazingly.
Yeah. And आप कोई ऐसे गैजेट्स, बिकॉज आपने बोला अलार्म वगैरह लेना चाहिए, सो आप कोई गैजेट्स वगैरह इस्तेमाल करते हैं फॉर फिटनेस?
कुछ भी नहीं.
बिकॉज आजकल बहुत चल रहा है, मैं देख रहा हूँ कि मैं अपने मोबाइल में
ज्यादा गैजेट्स इस्तेमाल करते हैं और कम एक्सरसाइज करते हैं.
सर ने मेरी बात करी, आई थिंक बहुत बुरी तरह. ऑल राइट गाइज, थैंक यू सो मच. यू गाइज आर अमेजिंग. एक बार अपने लिए जोरदार तालियां होनी चाहिए. एंड थैंक यू सो मच मिलिंद सर. जाते जाते एक बार दोबारा कहना चाहूंगा, व्हाट अ बिग फैन वी ऑल आर. हमारी मम्मियां कितनी बड़ी बिग फैन है, पापा कितने बड़े बिग फैन है, तो बीवियां. ऑल राइट सर, थैंक यू सो मच गाइस. एक बार अपने लिए जोरदार तालियां होनी चाहिए दोस्तों. थैंक यू सो मच.
Wow. What an absolutely engaging conversation that was. Thank you so much, Milind, for sharing all those exciting advices, suggestions and tips with us. And Mohit, I am shocked. Mohit ने कहा था मैं हर जगह से भाग जाता हूँ. जैसे ही उन्होंने बर्पी करने के लिए बोला, वो बस भागने ही वाले थे, but he kind of held you back. All right. Thank you so much. Can we please have a big hand one more time for Milind? May I now request the team to kindly set the stage for the next panel discussion that is lined up on a very exciting topic, that is adoption of technology for the better accessibility and affordability. What is the ground reality? Well, our panelists are going to share that very, very shortly, but right before I call them here on stage, we have a short video coming up here. Can we please have the video? Ladies and gentlemen, I think one thing which all of us really think about working upon is our wealth management and creation. So our DBS Bank experts are right out there at their booth, which will help you to create and manage your wealth better. So when you will get time right after the event, you're requested to kindly pay a visit to their booth. All right, so on that note, we are delving into the panel. And to moderate this panel discussion, once again, I would like to call upon Manas Tiwari, technology editor at Times Network, who would be driving this conversation forward. Manas, you're requested to please join us here. Welcome back again. Ladies and gentlemen, please join me in welcoming our esteemed panelists here on stage. We have Dr. Shiva Ranjani, pediatrician and social activist at Magna Centers, Hyderabad. Welcome to you, ma'am. Dr. Ruma Sinha, gynecologist at Apollo Hospital, Jubilee Hills, Hyderabad. Dr. Arvind Lal, managing director at Dr. Lal Path Labs. We have Mr. Raj Shekhar Pulabhatla, founder, Ethics First and partner founder, ISAC. He has several firsts to his credit as an entrepreneur. He is the nation's asset and has been setting stimulation labs in colleges and thus building fine cybersecurity professionals. Welcome to you, sir. And we also have Dr. Malini Pandey, Additional Registrar, Planning and Development at Dr. MGR Educational and Research Institute. Welcome to you, ma'am. Over to you, Manas.
Okay, so I'm back. So I think it's a very interesting time to talk about the role of technology, making healthcare affordable and accessible for all, given that only a couple of years ago, all of us saw a pandemic which changed the way we saw lives. And it also made us realize the importance of technology in healthcare and beyond that. So I want to open this conversation with that, keeping that point in mind, and want to know all of your opinion. How much in these 2 years have we really evolved and taken the value-based healthcare system? You can start.
So I'm a pediatrician, and during COVID, we all were sitting in our chambers, and we could actually guide many parents from remote areas also about how to take care of their children who had COVID. Actually, COVID wasn't very serious in children, but we could guide them, and all that we needed was this technology. So over a video call, we could guide them, we could ensure that they didn't abuse antibiotics or steroids, and they reached their children at the right time and they developed MISC. So yeah, technology helped us a lot during those times. And now we are able to incorporate the same thing in our practice now. Even now we continue to practice telemedicine, do video consults, and this made life easier for the parents and more affordable, and we are more accessible to the parents.
When you were, I'm sure, able to address a lot of these things through mobile phone, as ma'am just pointed out, but with India, I mean, large part of India still not being that tech savvy, what sort of challenges would you run into and how would you solve it?
I think it's wrong to say that India is not tech savvy. You'll find a smartphone in everybody's pocket today, and I think we should leverage that technology. As a gynecologist, in the last few years that we had COVID, we actually made a difference in two aspects. One, as gynecologists, we deal with pregnant women. And pregnant women, it became very difficult for them to come each time into the hospital. And just like Shivaranjani said, we leveraged the technology to be able to do the teleconsulting, telemedications. And so their visits to the hospital reduced, and we, of course, took care of them. However, being a minimal access surgeon and robotic surgeon in the gynecology field, we made a difference for women suffering from gynecological problems by using this technology to do surgeries for women so that their contact to the hospital reduced. We reduced their length of stay in the hospital. They could come in the morning, literally go in the evening or the next day. So and they would get better, so we don't need to keep them for days together in the hospital and reduce there. So, because the main COVID was a problem of people-to-people contact. And that's how we could leverage the technologies to be able to make a difference for women's health at that point of time.
And Dr. Arvind, you have a large footprint across India. You have in the diagnostic space. So how different were the times for you and how did technology help in that regard?
Our profession is absolutely based on technology. And the part of physically taking the blood, of course, that is different. But after that, it is all technology based. We can register the patient in his own home into our computers, etc., see what the tests are, and tell the patient through technology again when the result would be ready. And once the samples arrive in the main lab, it is all technology driven. I mean, the kind of automation which we have is absolutely, I mean, you will not believe it. It's like an automated kind of a factory. You know, hundreds of analyzers, there are tracks which are going, there are barcodes which are reading each sample, the tubes are moving in, and the automated computer-controlled analyzers are, taking the blood samples from one tube, putting it somewhere else, and mixing it with the reagent. And in real time, some report is being generated somewhere, which the doctors are, validating, and the report can be downloaded on the patient's, as ma'am said, on his own cell phone or on his own computer. So we are completely technology driven. In fact, we were the first people in India to use computers way back in 1986. So since that time, it's known as the Lab Information Management System, or LIMS, and we are children of technology.
But sir, as we keep integrating more and more artificial intelligence, more automated processes, what I want to understand, something that we discussed in the previous session also, that it requires complete reorientation or evolving of roles time to time in every few years. So how do we go about that? And I would like your input on that as well, because the healthcare workers are still the same. So how do you teach them? How do you help them, be reskilled and be up to date with these technologies?
So, again, artificial intelligence, as you heard today, and machine, learning. So we introduced artificial intelligence-based 2 tests more than 3 or 4 years ago. One is AI-based breast cancer diagnosis, and the other one is AI-based prostate cancer diagnosis. Both these cancers are very important. The breast cancer is the #1 cancer for women in India, and prostate cancer is #2 or #3 cancer for men in India. So the diagnosis of that is completely based on AI. And of course, the whole histopathology departments, including histopathology, I should say, they're all digitized. Now the pathologist is sitting, say, in Surat, and the slide is being seen in Delhi, and she can report on that slide. So that also, it's not being done by artificial intelligence now, but very soon it will be done. So that's the way we look at technology.
You want to add anything to that? In terms of reskilling, how do we go about it?
I would like to add a little bit regarding skilling. So I'm not a doctor, I'm not a medical doctor. I've been in the education field, and I feel there are certain skills that are very important if you want to leverage artificial intelligence for the students, for the faculty. So again, my perspective will be more of higher education. There is a skill called prompt engineering, which is how do you elicit the right response from AI? How do you leverage AI to get, answers? So a couple of years back, when we were using artificial intelligence, there was a lot of difficulty in terms of getting the right answer to the question that we are asking. So what is prompt engineering? It is about how do you prompt AI to give you information. Now, what do you need for that? That is a skill, You need to ask the right questions. You need to have that analytical mind to be able to, divide the question into parts and prompt the artificial intelligence, the AI tool, to give you the right answers. So I think we were talking about skilling, so I was just waiting for my chance to talk on that. And when we say that this 21st century young learners need to be ready for embracing AI, we need to train our faculty members also. I find that the biggest challenge, because so many of our faculty members are from another time, including myself, and AI is new to us. So until and unless faculty members are train the trainers, it's very difficult for the young generation to adapt to.
So what is more challenging, educating the students or training the faculty members with these technologies?
What is more important to us?
What is more challenging?
More challenging is training the trainers, training the faculty. Young people always tend to learn fast, right? Their mind is more, you have to unlearn certain things. And I'm telling for myself also, you have to first unlearn and then relearn. While when it is the young minds, they are fresh, it's like a fresh, fertile soil where you can plant a seed and a beautiful tree grows. So,
I think the point you raised is very valid. With all these new technologies like artificial intelligence, that large learning model, deep learning, there is, of course, the learning that we and our the generation that's building up should learn. But we also should understand that in all these large learning models, the ultimate output will be what we put as an input. So correct data has to be entered. Otherwise, the algorithms that will get created will give us the wrong answers. So today we are thinking and looking at our medical graduates 10 years down the line to actually put in the symptoms, put in the problems, and they'll get an answer. But they will only get the correct answer if today we have put the right information. So that is so very important, and I think that should be done with earnest
Absolutely.
and real value. So that makes a difference.
So when we talk about data, because it is the core of training any large language model, any AI model, how do you go about cybersecurity? How do we ensure that we, and whoever is using these models, they maintain certain ethical practices to train these and the data is still saved?
So see, first I'll quickly come to the COVID aspect of it. See, we are a highly tech-driven company, and when we ventured into the healthcare space before COVID, when we were starting our research, we were not as conscious of cybersecurity. But what happened was that with COVID happening, we started facing about 3,000 plus attacks on a monthly basis on our servers, which is when we were prompted to actually look more into it. Today, actually, as a company, we have learned over time that the data privacy is a big challenge for us. Again, as far as the challenge on the Indian front is concerned, yeah, people are tech savvy in India, but the problem is that people have smartphones, but the internet is a problem. All of them don't have the data packs that they need. So we, being a tech company, our biggest roadblock for success is that if they don't have a data plan, they can't use our apps for analytics and do things. Second problem is again hacking. Tremendous amount of attacks which happen on the platform, so we have to move to digital twinning. We are engaging a lot of hackers to help us making our platforms more secure. Data privacy, once the law comes into effect, then everybody is going to be having a hell lot of time, because
there's also this question of where the data is being stored.
Sorry?
Right? There's also this question of where the data is being stored.
Correct.
Eventually, yeah.
So the point is that data obviously it travels through multiple sources, and data centers again your app, there are so many insecure areas where it can be compromised. And we are just concerned right now that once the Data Privacy Act kicks in, like you're aware that now there's a law which says that if you're compromised, you need to report to certain 6 hours time. 6 hours, that I don't know how to deal with it, but that's what we are living in. So these laws are going to definitely be a big challenge for a lot of healthcare companies now, and it's for the best only. I'm sure. But cybersecurity is a key aspect of success now.
Yeah, I'm sure. Also, this is, I think this is a very large conversation to be had. I'm sure we'll keep having it in the years to come as AI keeps evolving and we keep integrating that more and more in our workflows, in our daily routine, in healthcare as well. Thank you so much for your time. That was my time. That was my questions. Thank you for your wonderful insights. Let's carry on with the show.
Thank you.
To felicitate all our panelists. All the panelists are requested to please stay back on stage for one more moment. Thank you. Thank you so much, Mr. Chadda. Ladies and gentlemen, we have with us Dr. Shiva Ranjani from Magna Centers, Hyderabad. Rohit, may I request you to kindly felicitate Dr. Shiva Ranjani. Thank you so much, ma'am, for sharing all your brilliant insights with us. Ladies and gentlemen, what an enriching discussion this has been. I think we all can bring our hands together. We have Dr. Ruma Sinha from Apollo Hospital, Jubilee Hills, Hyderabad. We also have the honor of having Dr. Arvind Lal, Managing Director, Dr. Lal Path Labs. Thank you for sharing all your brilliant insights with us, sir. We also have Mr. Raj Shekhar Pula Bhatla, founder, Ethics First and partner founder, ISAC. Thank you. Thank you so much, sir. Thank you for sharing your wealth of expertise and knowledge with us. We also have Dr. Malini Pandey from Dr. MGR Educational and Research Institute. Thank you. Thank you so much once again to all the panelists. Thank you, Rohit. Thank you, Manas, for brilliant moderation. May I request the team to kindly set the stage for the next part?
Yes, yes.
Sure. Okay. All right. So I remember during the session, Milind said one very interesting thing, that after every hour, perhaps we should indulge ourselves into some moment for a minute or so. Correct? I think it's been more than an hour now. And you all have been sitting here. So I think it's my responsibility, it's my duty to push you, and let's do something exciting. So, you know, on my way here, I met this very interesting gentleman who told me that, Namrata, I have certain instructions that I would like to pass on to all the healthcare professionals, experts you're about to meet today. I said, why not? I can do that for sure. So what do you say? Are you all ready to follow his instructions? Yes? Yes? Okay. Although I'm not going to reveal the name of that person to you, but let's assume it's Milind. Okay? So Milind says, everyone, please rise up from your seats. Come on. Let's all rise up. Let's all rise up. Fantastic. Let's all rise up. Now let's do one thing. There are a lot of people sitting there next to you at your table. I'm sure you know some of them, and of course you don't know some of them as well. So I think now is the perfect opportunity. Let's shake hands with them and say hi. Tell them your name. Come on, let's do that. Say hi, tell them your name. Say, you are awesome. Let's spread some awesomeness here. Say, you are awesome. Hey, you are awesome, man. You're awesome, girl. Wow. Fantastic. Fantastic. Super. All right. Everybody, let's all raise our left hand like this. Raise our left hand, raise our right hand, and clap 4 times. 1, 2, 3, 4. 1, 2, 3, 4. Fantastic. Time to do some movement. And I think when you're sitting, so your lower body is usually maximum involved. Let's just move that, okay? Come on, let's move that. And you will feel relieved. You will feel better. You will feel much better. Yes. He's enjoying that. Fantastic. Amazing. Let's give a big round of applause for yourselves. Thank you so much. I think I got my buzzer that we are a little short on time, so you're requested to please be seated. But I think that was a relief for most of us. All right, so on that note, ladies and gentlemen, we are now delving into the next segment of Times Network India Health Awards 2024. And for the same, once again, I would request Rohit Chadda and Milind to please join us on stage. And I would also request Dr. Arvind Lal, Managing Director, Dr. Lal Path Labs, to please join us on stage as well. Ladies and gentlemen, we have Dr. Arvind Lal, Managing Director, Dr. Lal Path Labs, joining us up on stage now. So with this, we are moving on to our next category of awards, which is Excellence in Fertility Care, Delhi. And it goes to Dr. Suyesha Khanijao, OB-GYN, Infertility Specialist. May I request you to please join us on stage. Congratulations to you, Dr. Suyesha. Our next award category is Excellence in Cardiothoracic and Vascular Surgery. And it goes to Dr. Satyaki P. Nambala, Head Cardiac Surgery Unit at Apollo Hospitals, Bengaluru. May I request Dr. Nambala to please join us on stage, and since he's not here, so can we please request Dr. Karan Thakur to kindly join us on stage and receive this award on his behalf. Many, many congratulations to you, Dr. Nambala. Our next award category is Excellence in Diabetic Foot Specialist and Podiatric Surgeon, Chennai. And it goes to Dr. Prem Kumar, MD, Chennai Diabetes Foot Care. Moving on to the next award category, which is Excellence in Varicose Veins Treatment. And it goes to Dr. Raja V. Kopala, Managing Director and Senior Varicose Vein Specialist at AVIS Hospitals. Dr. Kopala, you're requested to please join us on stage to receive this award. Moving on to our next award category, which is Most Promising Company in Pharma SME. And it goes to Radhe MedTech Private Limited. May I request Mr. Ashish Vasani, Ms. Khyati Vasani, directors at Radhe MedTech Private Limited, to please join us on stage and receive this award. Congratulations to you. Many, many congratulations. Thank you. Thank you so much, Dr. Arvind, for joining us here and doing the honors. May I request you to please have a seat now? Yeah. Thank you so much, sir. Ladies and gentlemen, moving on to our next award category, which is Best Orthopedic Hospital, Chennai. And it goes to MGM Healthcare, Chennai. Many, many congratulations. May I request Zubin to please join us on stage and receive this award. Ladies and gentlemen, I believe we can give a better round of applause than that. Let's bring in some more energy, please. Thank you. Moving on to our next award category, which is Pioneer in Healthcare AI. And it goes to Elsevier. May I request Dr. Hema Jagota, Country Director, Elsevier India, to please join us on stage and receive this award. Congratulations. And I think we can do better with applauses. Can we please have a roaring, roaring round of applause for Elsevier, ladies and gentlemen. Next up, moving on to our category, which is Excellence in Cardiac Electrophysiology and Pacing, Hyderabad. And it goes to Dr. Somen Devidatta, Senior Consultant Cardiology. May I request Dr. Devidatta to please join us on stage and receive this award. Ladies and gentlemen, our next award category is All India Expert in Robotic Joint Replacement Surgery. And it goes to Dr. A.V. Gurava Reddy, Managing Director and Chief Joint Replacement Surgeon at KIMS Sunshine Hospitals. May I request Senthil and somebody from the team to please join us on stage to receive this award. Many, many congratulations to Dr. Reddy, although he's not here. But I think we can still give a big hand for him. Come on. Our next award category is Excellence in Trichology, Mumbai. And it goes to Dr. Stuti Khare Shukla, Founder and Chief Dermatologist at SKS Elements of Aesthetics. Dr. Akshat Shukla also to please join us on stage as well. Okay, so first of all, let me tell you, let me compliment you. You're looking absolutely gorgeous this evening. And I think you are the bling here of this entire platform. You're the bling. So we would love to have a few words from you.
Hi everyone, I'm Dr. Stuti Khare Shukla. I am a trichologist, hair growth specialist. I want to ask Milind Somanji, what is the secret of his good hair and good skin? Is it like genetics or you're taking good care, hair care or skin care?
So I eat a lot of fruits.
Good.
Can you hear me? I eat a lot of fruits and a lot of vegetables. And whenever I eat any fruit, I rub the peels on my face. Yeah. And if there's some pieces I don't like, I put them in my hair.
And how about genes? I think it's good genetics also.
Yeah. No, of course, good genes. I mean, you should see my mother, really beautiful. And, but I think we need to take care of our genes. You can't just rely on genes. You know, you can even improve on your genes, the genes that you pass on to the next generation. That is our responsibility.
So all doctors would agree, good genes plus good lifestyle. That's how it is.
Thank you. Thank you so much, Milind, once again for sharing all those amazing tips with us. Congratulations to you, Dr. Stuti, once again. Can we please have a big hand? And I think eating fruits and vegetables, making use of their peels, I think this is something which our nannies and grandmas have always taught us. And we still fail to apply those methods in our daily life. I think we should do that, of course, going all natural. Thank you. Thank you so much, Milind, once again. Ladies and gentlemen, our next award category is Best Fertility Pharma Company. And it goes to Samarth Life Sciences. May I request their team to please join us on stage and receive this award. Samarth Life Sciences. Many, many congratulations to you, Samarth Life Sciences. Ladies and gentlemen, I believe we can put our hands together louder, louder for them. Many, many congratulations once again. The Best Fertility Pharma Company, ladies and gentlemen, Samarth Life Sciences. Our next award category is Excellence in Integrative Medicine, Hyderabad. And it goes to Dr. Praveen K. Saxena, Managing Director, Dr. Saxena Integrative Medicine. Dr. Saxena, can we please have you here on stage? Yeah. Congratulations. Many, many congratulations to you, Dr. Saxena. Ladies and gentlemen, please put your hands together for Dr. Praveen K. Saxena for his excellence in integrative medicine. Fantastic. I think, sir. Sir, the photographer is actually waiting for you to get a picture click. Yes, let's do that. Ladies and gentlemen, our next award category is Best Health Tech Solution. And it goes to Fedo.ai. May I request Mr. Prashant Madhvana, co-founder and CEO Fedo, to please join us on stage and receive this award. Okay, everybody, ladies and gentlemen, can we please put our hands together louder for Fedo.ai? Ladies and gentlemen, moving on to the next award category, which is Excellence in Nephrology, Hyderabad. And it goes to Dr. Ashwini Kumar Panigrahi, Senior Consultant Nephrology. May I request Dr. Kumar to please join us on stage and receive this award. Congratulations to you, Dr. Panigrahi. Ladies and gentlemen, now we are moving towards a very special award. It's a Lifetime Achievement Award. And it goes to none other than Dr. Arvind Lal. May I request Honorary Brigadier Dr. Arvind Lal, Padma Shri, Executive Chairman, Dr. Lal Path Labs Limited, to please join us on stage and receive this award. Thank you so much, sir, for all your incredible contribution to the healthcare industry. Ladies and gentlemen, I believe we can hear a thunderous round of applause from all of you as we are honoring Dr. Arvind Lal with a Lifetime Achievement Award. Many, many congratulations to you, sir. With this, we are now moving to a very important segment, because now we are going to gratify, acknowledge and honor our sponsors, without whom this entire initiative would not have been taken. So I would humbly request Milind and Rohit to kindly felicitate them. So ladies and gentlemen, this initiative is powered by DBS Bank. Right before I call our representative of DBS Bank on stage, we have a short video that we would like to play here on the screen. Can we please have the video over here? And that, ladies and gentlemen, is DBS Bank, which is your perfect companion for your wealth management. May I now request Ms. Shweta Singh, Executive Director and Zonal Head North and West NDS at DBS Bank India Limited, to please join us on stage. Rohit and Milind, may I request you to kindly honor Ms. Singh with a token of appreciation and gratitude. Thank you so much, DBS Bank, for your wonderful association and partnership with Times Network. Ladies and gentlemen, please give a big, big hand for DBS Bank. Ms. Singh, there is a very popular saying, health is wealth. So where all our healthcare professionals and doctors are taking care of everyone's health, please tell us that how DBS Bank has been taking care of their wealth. I think it's very interesting when I think about it. So,
thank you. Thank you. But before we go there, I think RJ Mohit ne mummy ki baat ki thi. So it triggered a thought, and may I start there? So 10 years ago, Milind, I had done the 100-kilometer Oxfam walk with your mother. And she was such an inspiration for all of us. We were not in the same team, but we decided, to just walk with her team and make sure we finish. And that's how we did it. So she was an inspiration for so many of us to do, push yourself, push your boundaries, and, do anything you set your mind to. So coming back to this evening, I think DBS Bank is extremely honored to partner with Times Network for the India Health Awards. And a hearty congratulations to all the winners and our heartfelt gratitude to all doctors for the work you do. And we really mean it from the bottom of our hearts. We feel more confident in doing what we do because we know all of you are around us to take care of us when we need you. So thank you for that. Our tagline actually says it all. Tagline of DBS is live more, bank less. And what we really mean to do there is to make sure that banking blends into your life, offers you product solutions that are tailor-made for you and suit your requirements. And we do that through our flagship proposition called Treasures. It is meant for HNI clients like all of you. And we invite you to experience Treasures banking with DBS. We have a kiosk outside. We have a team of relationship managers who are experts in this field who will guide you through this individually. And we have a network of 525 branches in 350 cities of India. So we are there everywhere. You will need us. And we hope to get a chance to serve you. Thank you, and live more, bank less.
Thank you. Thank you so much, Ms. Singh, for all your kind and wonderful words, and thank you so much for this brilliant partnership. Can we take a picture together, I believe, if you have not? Yes, very quickly. Thank you. On that note, ladies and gentlemen, I would now like to call upon stage our luxury real estate partner, M3M India. May I request their representatives to please join us on stage. Mr. Kaul, can we please have you here? Ladies and gentlemen, let's give a big hand for M3M India, being the luxury real estate partner for Times Network India Health Awards 2024. Thank you. Thank you so much for this great camaraderie that we share. I think we can do better with applauses. Come on, everyone. I would now like to call upon stage our luxury partner, Silver Arrows. May I request their team to please join us on stage. Silver Arrows. Thank you so much, Silver Arrows, for all your support that you have shown towards us in helping us organizing India Health Awards. Ladies and gentlemen, can we please have a big hand for Silver Arrows upon being a luxury partner? And we have our knowledge partner, Dr. MGR Educational and Research Institute. May I request Dr. Malini Pandey to please join us on stage. Along with the team, of course. Thank you. Thank you so much once again to all the sponsors. Can we please have a big round of applause for them once again? Thank you. Milind, what an honor having you here. All the advices, all the suggestions, all your tips, your journey that you shared with us, it has It has left an indelible mark on our hearts and minds, and I think it's going to be pretty useful for a lot of us, especially Mohit, who has just ran away. So thank you so much once again for marking your magnificent presence here. Rohit, may I request you to kindly honor Milind with a token of appreciation. Team, may I request you to kindly bring it here. Ladies and gentlemen, let's have a big round of applause for Milind Soman. Thank you. Thank you so much for always inspiring all of us. Thank you so much. What a pleasure having you here. Thank you once again. Rohit, may I request you to kindly stay back on stage? I think what a knowledge-packed evening this has been and absolutely inspiring for all of us. So I would request you to kindly conclude this with your words.
Good evening once again, everyone. Let's give a big round of applause to all our incredible winners this evening. Thank you for joining us at the Times Network Health Awards. A special thank you to Mr. Milind Soman for this inspiring presence that he's brought to the evening. I would like to also extend a heartfelt gratitude to Ms. Shweta Singh, Executive Director and Zonal Head, North and West NDS, DBS Bank India, Dr. Randeep Gurela. Sorry, 1 second, please. Dr. Randeep Guleria, Dr. Raja V. Kopala, Mr. Gaurav Parchani, Mr. Prashant Madhavan, Dr. Shivranjani Santosh, Dr. Ruma Sinha, Dr. Arvind Lal, Dr. Malini Pandey, Mr. Srinivas Vivek, Dr. Madhu Shashidhar, Dr. Sunil Rao, Dr. Rahul Bajpai, and Mr. Sarvanan Raman. As we celebrate the remarkable achievements in healthcare, let's look forward to a future filled with innovation and hope. Please do explore healthandme.com and share your valuable feedback with us. We also welcome doctors and experts to contribute their knowledge and help us educate the masses. Here's to a healthier tomorrow and a wonderful evening ahead. Thank you.
So much, Mr. Chadda, for all your inspiring words. May I request you to please stay back on stage for one more moment. I'm going to request your presence here. Ladies and gentlemen, what an incredible evening this has been. So tonight we have honored the excellence, the innovation, the transformative impact that all our healthcare experts, the professionals have been making in the industry. I think we would do an injustice if we won't mark this moment in our memories. So I think to forever etch it in our memories, we should take a group photograph. So can we please request all the winners, along with their awards, to please join us on stage and let's make some memories here. Can we please have you all here? All the winners along with their awards. A humble request to all the winners to please join us on stage. And let's take this group photograph together. Because we're a part of one family, and that family is healthcare. And we're absolutely elated to see so many people leaving a great impact, a great mark on the industry. Everybody, please join us on stage together. Yes, let's not wait up, because we're just waiting for you to be a part of the photograph, everyone. Let's join us on stage. I hope you're not missing out on anyone. All right. I think we're not missing out on anyone now. Ladies and gentlemen, I hope all of you fit in the frame. Sir, can we please have you a little in the front because you are not visible from the back? Yes, just a little in the front. Fantastic. Folks, a little together. Please show your awards. Show your trophies to the camera. You all are the achievers. You are the winners. You are the ones who have been leading the change and leaving an impact on the industry. You have made the mark. It's time to celebrate all of you. So with some good smiles, everybody, let's take this picture. Ladies and gentlemen, can we please have a big, big hand for all the winners, all the achievers? Please put your hands together louder. Wow, Asha, one more picture. Okay. We actually want to take one more picture, so the lady has just joined us here. Fantastic. Wow, it's a great time to make some memories. May I request Mr. Shashidhar to please stay back on stage, the respected president and CEO of Apollo Hospitals Group. Sir, you're requested to please stay back on stage since we want to have a picture with the entire Apollo team here. Oh, yes. Okay, super. Ma'am, you got like a little late, but that's all right, I think. Everybody waited up. That's fantastic. Mr. Chadha, you're requested to please stay back on stage for one more moment because we're about to take one more photograph. Congratulations to all the winners once again. Thank you so much, everybody. Thank you. Dr. Shashidhar, you're requested to please stay back along with the entire team of Apollo Group of Hospitals. Can we please have you here? And Mr. Chadha, can we please have you on stage as well? Yes. Apollo Group, yes. Can we please have you here? I hope everybody is a part of the picture now. Fantastic. Wow, what an incredible team. What an incredible family of Apollo. Congratulations to all of you. And thank you so much once again, everybody. Thank you so much, Mr. Chadha. We want one more picture or just the team? Okay, just the team. Fantastic. Yeah. One more picture with the team. Phenomenal.